Congratulations on receiving a kidney and/or pancreas transplant. This series of educational videos gives you an overview of basic discharge information that will make your transition to home more successful. Over the next few months, your transplant care team will teach you more about what you need to know at your follow-up visits. Write down any questions you may have so you can ask them during your follow-up appointments. In this video, we will talk about how to monitor yourself at home and some of the things you should not do while you recover. The nurse coordinator will give you a monitoring flow sheet before you are discharged. You will need to keep track of your intake, how much you drink, and output, how much urine you make. This is called I's and O's. You need to measure your I's and O's for the first 3 to 4 weeks. Your care team will let you know when you no longer have to record your intake and output. Try to drink 3 liters of water every day unless your care team tells you your fluid goal is different. You may go home with the urinary catheter. The nurse will show you how to care for the catheter and empty it. The care team most often removes the catheter after 5 to 7 days. If you have a Jackson-Pratt drain, often called a JP drain, record the output 2 to 3 times per day and record the color and amount of drainage. Your nurse will show you how to care for and empty this drain. Call your care team right away if you have a sudden increase in output or if the color changes to bright red or looks bloody. Pink, orange, yellow, and clear fluids are normal. People with diabetes check their blood glucose levels, but after transplant, blood glucose levels can rise. So even if you do not have a history of diabetes, we still may want you to check your blood glucose after you leave the hospital. If you need to do this, your care team will teach you how. Check your temperature every day and call if it is more than 101.5 degrees Fahrenheit. You will also need to check your blood pressure and heart rate 2 to 3 times every day. Before you leave the hospital, we will give you a blood pressure cuff to use at home. It's important to make sure that the cuff is the right size for you. If you are not sure how to do this, please ask the nurse on the transplant floor to help you. If you need a different size, you can buy another cuff online. You will use a flow sheet like this to record your measurements every day. Bring your flow sheet to all your follow-up clinic visits for the first month. After the first month, you will most likely only need to record your blood pressure, temperature, and heart rate. When you run out of these forms, you can just write your measurements in any kind of notebook. For your safety and for the best surgical outcomes, you must avoid some activities for the first 6 weeks after surgery. For the first 6 weeks after surgery, do not lift, push, or pull anything heavier than 10 pounds. That's about the weight of a gallon of milk. This can be hard if you have small children or larger pets. If that is the case, you can have someone hand them to you while you are sitting on a chair or the sofa. Do not pick them up or take the pets out for a walk. We want you to start walking as soon as you can. Light exercise is good for you. If you have a day that you are not feeling as well, try to get up and walk around for 10 minutes every hour. However, do not do any strenuous activity such as intense workouts. Do not twist or bend at the waist. Do not drive until your clinician takes your staples out. You also should not drive if you are taking narcotic medications. These may be your prescription pain medications. Next, we will have a brief overview of incision care. Your staples will be removed at your 3-week appointment. There could be areas in your incision that need more time to heal. Some staples may remain in place and will be removed at a later date. If your staples are pulling on your clothing, you can cover your incision with gauze. Just ask the hospital and clinic for supplies when you need them. It is okay to shower with mild soap and water, even if you still have drains in. Just have the shower head to your back and let the water and soap run over the incision. You can use a light cloth or loofah to cleanse the area. Do not soak your incision. No soaking in bathtubs, hot tubs, swimming pools. These should be avoided for 6 weeks. Once the incision is completely healed and no scars are left, you can then take a bath. Please check with your team prior to doing this. It is okay to put mild creams or lotions around the incision. Keep your incision clean, dry, and open to air as much as you can. There is no need to put a dressing over your incision. Drainage is normal. This often can be alarming to some patients, but this is expected. If there is a large amount of drainage present, you can cover the incision with the dressing as needed. Pinkish drainage is okay. Please contact the clinic if the color is bright red, bloody, pus-like, or foul-smelling. Call the transplant clinic right away if you have any of the following symptoms. Your incision is warm, red, swollen, or has foul-smelling pus-like drainage. The incision appears to be opening up. There is a big increase in the amount of drainage from your incision or drain. The drain output color becomes brown, green, or milky white. The drainage from the incision or old drain sites become bright red, pus-like, or foul-smelling. You start having nausea with vomiting or diarrhea that lasts for more than 24 hours. We consider diarrhea to be more than 4 episodes of watery stool in 24 hours. Your temperature is more than 101.5 degrees Fahrenheit. Your blood pressure is consistently more than 160/110 or less than 110/60 for more than 1 day. Your incisional pain becomes severe pain or is not managed with a prescription pain medication. If you stop making urine or have consistent pain, urgency, or burning when you urinate, your urine gets dark brown colored or bright red with blood clots in the urine larger than a quarter, or you develop mouth sores. The transplant nurse coordinator will talk with you about this information in person. They will be able to answer any questions you may have. You can now view video number 3 in this series. Thank you for trusting Northwestern Medicine.